Bloating, gas, diarrhea, constipation, skin issues, thyroid dysfunction, various autoimmune diseases, these are all symptoms and risk factors for SIBO, or small intestine bacterial overgrowth. In fact, SIBO is one of the most common conditions I see at my clinic. In some patients, it's the primary condition, especially anyone struggling with irritable bowel syndrome or IBS. New research has even shown that 50% of IBS cases are actually undiagnosed SIBO, which is totally correctable. However, it is also often a root cause of larger and more complex conditions, including chronic infections, toxic exposures, Hashimoto's, and a whole host of other autoimmune diseases. It is not uncommon for SIBO to also be the culprit that triggers skin conditions like rosacea, eczema, and various skin rashes that people often will experience. So what is SIBO? As the name suggests, SIBO occurs when you have an overgrowth of bacteria but in your small intestine, and that's where you absorb most of your nutrients. While your gut microbiome contains trillions of bacteria, your small intestine should only contain a very small amount of flora. Most of your beneficial flora lives in your large intestine or your colon, where it helps break down food, eliminates waste, supports metabolic functions, along with various other roles that we have found that are important for maintaining optimal wellness. The problem happens when these otherwise friendly bacteria take over and colonize in your small intestine, where they don't belong. Once that occurs, anytime you eat starchy foods like bread, rice, pasta, or even some healthy prebiotic-rich foods like garlic or apples or chicory root or artichoke, the bacteria in the foods the bacteria ferment the sugars in the foods, which produces gas. And all of this gas leads to serious bloating. Whenever a patient comes into my office saying they wake up in the morning with a flat stomach and by the end of the day it looks like they're 5 months pregnant, my SIBO radar goes off. Bloating is never normal, so if you're experiencing bloating, you need to find out why it's there. SIBO can also lead to a long list of other uncomfortable symptoms as well, including diarrhea, constipation, abdominal pain, food sensitivities, histamine intolerances, and the list goes on and on and on. More importantly, all of these bacteria also interfere with nutrient absorption, leading to nutrient deficiencies and the complications that go along with it, including chronic fatigue. Your gut is also where 20% of your thyroid hormones are converted from their inactive state to their active state. If your microbial balance is disrupted, this can lead to low thyroid function. It can trigger Hashimoto's or Graves' disease. So we have to be careful about treating the gut appropriately to make sure these things don't happen. Even more problematic, this overgrowth of bacteria will cause intestinal permeability or leaky gut issues. This is where the tight junctions in your small intestine open up, allowing bacteria, toxins, viruses, and undigested food particles to escape the gut lumen, enter the bloodstream, and cause all sorts of problems. All of these foreign invaders that enter into the bloodstream will cause a spike in inflammation, and that can lead to autoimmune diseases like lupus, rheumatoid arthritis, Sjogren's, scleroderma. Everybody has heard of all of these nasty conditions. As you can see, this is a big problem with some serious consequences. So what causes SIBO and what can you do to stop it? So SIBO can be caused by various factors, including low stomach acid, a diet high in carbohydrates and processed foods, taking antibiotics, taking proton pump inhibitors, nerve or muscle damage in the small intestine, stress, infections, toxins, and constipation. These are just a few. If you suspect that you have SIBO, your doctor can order a breath test that measures the gases produced by the bacteria in your small intestine to see if this is a problem that's contributing to your symptoms. You can also do an organic acid test to look for evidence of small intestine fungal overgrowth, which is also known as SIFO. Both conditions will often go hand in hand, and it's important to have that full picture because if you treat one and not the other, you're not going to get the results that you're looking to achieve. At Grassroots Functional Medicine, we often use a combination of 2 herbal supplements that help kill off both the bacteria and the fungal overgrowth without harming the good flora, SIBOcide and Candicide. These supplements have been well researched and have actually been compared to the main drug that's used for SIBO in the conventional world, Xifaxan, and the herbs have shown to be as effective, if not more effective, and much safer. We also use dietary protocols to starve the bacteria by not giving them the added carbohydrates and sugars that allow those bacteria to thrive. And most importantly, we have to think about the environmental factors and the stressors and the medications and all of those culprits that lead to the problem in the first place. Once your gut is back in balance and it is restored, your digestive symptoms will disappear and you can begin your recovery from the cascade of problems that may have been caused from the SIBO. If you're ready to get to the bottom of your symptoms and you believe that SIBO or other digestive issues may be to blame, I'd love to help you get some clarity on what is truly going on. My name is Dr. Seth Osgood and I'm the founder of Grassroots Functional Medicine. We have a clinic in West Lebanon, New Hampshire, a new location in Burlington, Vermont, and a satellite location in Austin, Texas. Visit us on our website, grassrootsfunctionalmedicine.com, or call us at the clinic. And if this seems like something that is a good fit for you, set up a free 10-minute consult with me so we can talk about your case and we can talk about the approach that we would take to get you better. And more importantly, make sure that we're a good fit for each other. We're looking for a specific type of patient who is ready to do what it takes to feel well, who's ready to make the necessary changes to get them optimum results. So I really look forward to hearing from you. Life is too short to live with debilitating symptoms. You should be feeling vibrant. You should be thriving. You shouldn't be struggling from day to day. Again, my name is Dr. Seth Osgood, and I really look forward to chatting with you. I hope you have a blessed day. Thanks.